So, yeah, today we're going to be learning a little bit about ultrasound, particularly in the context of tracking vesicle length changes. Um, and we'll start off just by talking about why tracking vesicle length changes is important. We'll talk a little bit about how to distinguish between different structures in our ultrasound images. And then we'll sort of talk a little bit about the different computer vision methods that allow us to get videos like this tracking changes in vesicle length. So, if we can measure the instantaneous length and velocity changes of muscle in relation to some optimum, that gives us an idea of the instantaneous operating capacity or force generating capacity of that muscle. We know that under really controlled static conditions, um, the force length curve of a muscle has this ascending limb, it has a plateau, and a descending limb with maximum active force being able to be produced at this plateau. On the other hand, we have this sort of sigmoidal relationship between force and muscle velocity, with positive values corresponding to muscle shortening and negative values corresponding to muscle lengthening. But again, if we know the relative length and velocity of a muscle, we can approximate how the operating capacity of that muscle changes, which has implications for understanding how and why people move the way that they do, and potentially how we might facilitate movement, targeting those length and velocity changes. So Rubinson et al. Were able to sort of carefully set up participants in a dynamometer, which for those of you not familiar, a dynamometer is a device that can measure the force and power produced by joints. And they had ultrasound over the soleus muscle at the same time. So in the bottom of this ultrasound image, this muscle that I'm hovering over here is soleus, and above you'll have medial gastrocnemius. And then within the dynamometer, with the ultrasound over those calf muscles, by setting the ankle at different joint angles, changing then the length of the soleus muscle fibers to shorter or longer lengths, and then having participants maximally produce force at those different joint angles, they were able to generate force length profiles for the soleus muscle for each of their participants. Then after creating those profiles, they then kept the ultrasound over those muscles, took them out of the dynamometer, and had them walk, again, with that ultrasound still on, to see where on the force length curve soleus tends to operate throughout a walking stride. And you can see that on average, it sits around this ascending part of the plateau here, which would be ideal potentially in terms of balancing between force production and making sure that there's room for muscle to still lengthen, say in the case of perturbation needing to be resisted, or having to minimize injury risk due to rapid stretch or high force. On the other hand, Lai et al. Were interested in the speed at which we decide to transition from a walk to a run. And again, with ultrasound over the soleus muscle, and with sort of an estimate of the optimal fascicle length of soleus, they were able to show that the preferred speed to transition from walking, which would be this dark line here, to then running, this dashed line here, sort of keeps the muscle operating near to optimal fascicle lengths. So as indicated by this fascicle length equals 1 or L naught. And it also was able to keep muscles operating at shorter velocities as well. So ultimately, this is all better for force production, right? And interestingly enough, if we weren't to transition at this point, we were just to keep walking at faster and faster speeds without transitioning to running, we would see that the energetic cost of walking would start to exceed the energetic cost of running at those speeds. And speaking of energetic costs, my group was able to demonstrate these really tight relationships between metabolic cost here and the amount of fascicle shortening and shortening velocity of calf and quadriceps muscles across different hopping conditions. And as I briefly mentioned before, we can also think about this from the perspective of facilitating movement, enhancing muscle dynamics through potentially some sort of assistive device. Here using passive ankle exoskeleton during walking to assist plantar flexion and varying the stiffness of that exoskeleton. Knuckles et al. Were able to find that stiffness was affecting the force generating capacity of muscle. They also found that compared to no exoskeleton assistance, this blue stiffness level actually reduced the metabolic cost of walking, whereas these higher stiffnesses increased the metabolic cost of walking rather. But the main thing really to take away from this whole slide for the purposes of this presentation is that ultrasound was used in each of these studies to measure muscle dynamics non-invasively in humans to enhance our mechanistic interpretation. But that's not all that ultrasound is used for. In research at this sort of intersection between human biomechanics and physiology, we also use it to guide the placement of intramuscular sensors. That might be intramuscular EMG to really precisely measure muscle activity, or a thermistor to measure muscle temperature. And using ultrasound then allows us to sort of insert these sensors exactly where we want them without nicking surrounding vasculature or nerves along the way. We can also use ultrasound or 3D ultrasound. So similar to what we can get from an MRI, we can use we can use freehand 3D ultrasound along the length of a muscle to give us more information structurally about muscle and how muscles vary between individuals. We can also use an ultrasound technique called strain elastography, giving us a measure of the relative stiffness of tissues within and between individuals. Or we could look at cardiovascular biomechanics. Again, not only looking at the stiffness potentially of vessel walls, but also the velocity of blood flow in response to maybe different exercise conditions or conditions like hypoxia or hypothermia. So how does ultrasound work? You have a transducer that sends ultrasonic waves down into the body, and then those waves bounce back to the transducer when it hits an object, sending information to a computer software to generate an image. Ultimately, the speed and strength at which those waves reflect back to the transducer determines how different structures will appear in an image. And so that speed and strength as well, the echogenicity, as we call it, of structures varies depending on their physical properties. And so what do different structures look like in an ultrasound image? And fair warning, it's usually not just as easy as me telling you here, this structure looks like this and this structure looks like that. This is something that requires sort of getting hands-on with the ultrasound, adjusting settings, playing with orientation of the probe, scanning different parts of the body. But hopefully I can give you a bit of an idea as to the sorts of things to look for to help to differentiate between one thing from another. Quite simply, blood and other fluids are anechoic. They don't reflect ultrasound waves and show up as dark in your image. So if we look here at both of these still images up the top, it's quite easy to know that you're looking at a blood vessel because it'll show up as a dark circle. So we can see this dark circle up here in the top left image, and there's a big dark circle here in this rightward image. And again, it might take a little bit of adjusting the orientation settings of the ultrasound probe to be able to see these structures really clearly. But once those settings are in, this should be really easy to be able to distinguish. On the other hand, bone, the connective tissue in muscle, tendon, and nerve are echogenic. So they show up, they're really good at reflecting ultrasound waves, and they'll show up as bright white in the image. When we look at bone, so here we have the humerus, we can see the outer part of bone shows up as bright white, and there's almost like this shadow underneath it. That's because ultrasonic waves will reflect off of the surface layers of bone, but they can't penetrate deeper than that. When it comes to identifying muscle, it's usually fairly obvious. One thing to note here is that the probe is being held transversely across the limb, which is sort of best for differentiating between different structures. In our application of tracking fascicle length changes, though, the probe will be held sort of longitudinally along the limb. In either case, muscle is usually super easy to identify. It contains these sort of striations of connective tissue, and usually the aponeuroses sort of surrounding muscle and interspersing between muscle helps to make it obvious that you're looking at muscle too. Tendon, on the other hand, is sort of identifiable as being circular, changing in size along its length, and obviously as well extending from muscle. So we should be able to track muscle towards its origin or insertion points and see tendon appear. Nerves are also circular, but their size doesn't change along its length. So we'll see this a little bit more in a video that I'll show you on the next slide. Typically, nerve is going to be near blood vessels as well. So some of you may have heard the acronym VAN, vein, artery, nerve. So you can sort of see in this top right image that we've got this vein structure, this nerve structure here sitting next to this artery structure. So that's a little bit of a giveaway for this one as well. But this can be a little bit complicated to find sometimes. But this is a recording that I took of my sciatic nerve. It might be a little bit glitchy on your screen. I'm hoping the videos play with a high enough frame rate, but this is the main nerve that obviously branches off to innervate your leg muscles. And you'll see that it doesn't really change shape too much as I sort of sweep up and down my thigh. It might not be as clear in some parts because of the orientation again and sort of settings of the ultrasound probe that I'm using, but right next to it, you'll also be able to see sort of two circular dark structures as well. Again, sort of giving away that we are looking at a nerve here. So I'll just let this play through to the end. Again, hopefully not too glitchy on your end. I'm sort of keeping the cursor over where the nerve is. Here, this sort of bundle of connective tissue. It will come in and out of image.
Can I ask a little bit of a question?
Yeah.
So what else are we seeing in this? We're not just seeing just the nerve, right? This is like the subcutaneous layers
You're
up
not
on the
just
top.
saying,
Yeah.
yeah, exactly. So you'll have subcutaneous layers up the top. There's probably some amount of muscle in and surrounding this nerve here. Again, I've sort of tried to dial in these ultrasound settings so I can try to get a good image of the nerve. The other disadvantage of the ultrasound system that I'm using at the moment is that it is sort of dialed in for musculoskeletal ultrasound work. I've mainly used it for muscle in the past, but it's not quite as, the images aren't quite as clear as what you'd get from like your typical medical ultrasound probe, the handheld sort of probe. I'll show you the different sorts of probes coming up in a later slide. But just to give you an idea of what this should look like, not that this is really the main focus of this presentation, but we could then confirm using Doppler ultrasound that there is sort of this pulsing happening next to the nerve. Again, unfortunately, you might not be able to see this perfectly because the video is a little bit glitchy, but you should see this blue pulsing almost next to this nerve structure, which is sort of in white here. And typically, when we're using ultrasound as well, we've got it in what's called B mode or brightness mode, which is what we use for ultrasound, which is what we use, sorry, for musculoskeletal imaging. Um, Again, here I've got it in what's called Doppler mode, which is used for measuring blood flow. Less about nerves though, and blood vessels, and more about muscle. And here I've switched the probe from transverse to longitudinal, starting with a probe over the most medial aspect of my medial gastrocnemius, slowly bringing it around my calf. Now over sort of the aponeurosis surrounding my medial, or interspersing between my medial and lateral gastrocnemius. So I'll start again. Medial gastrocnemius, really medial part of my medial gastrocnemius, going around my calf towards my lateral gastrocnemius. Um, Here's the aponeurosis coming in that will disperse between my medial and lateral gastrocnemius. Now lateral gastrocnemius with a good shot of soleus below. Um, and again, with sort of the probe held longitudinally, in this case, we can really nicely see sort of these striations of connective tissue, those being the fascicles that we want to track. And here's sort of a nice video that really nicely shows motion capture data synced up with ultrasound over biceps femoris. And I really want you to appreciate how clearly we can see changes in the length and pennation angle of fascicles in each of these different movements. So again, over biceps femoris, so over hamstring muscle there through those movements. And for a muscle like biceps fem, where you might have these really long fascicles with quite small pennation angles, we might elect to use two ultrasound probes in series with one another so that when it comes to tracking fascicles, we have visual of the insertion and origin of the fascicle rather than just relying on some sort of extrapolation. So we're going to talk about sort of these automated methods on the next slide. I'm not too sure where these automated methods are at the moment in terms of tracking two images stitched together. In the past, we've had to do all of this sort of tracking manually, frame by frame, which, as you can imagine, is pretty time intensive, going from one frame, clicking, next frame, clicking, when some of these ultrasound videos are 1,500 frames of data or more. So the fascicle tracking software that we'll be using today revolves around two different computer vision methods, optical flow and line detection. In optical flow, you're essentially tracking the motion of key points or key pixels within an image. So you can imagine here the direction of these blue points being tracked from one frame to the next. Whereas with line detection methods, I'm just checking the chat. Um, Whereas with line detection methods, uh, the software will be looking for line-like structures from one frame to the next. So those line-like structures being fascicles in our case. Optical flow works on consecutive frames, whereas line detection works on each frame independently. And what this means for the tracking is that optical flow is really good for handling noise within a video, but it is prone to drifting over time, whereas line detection, because it's working on each individual frame independently, it doesn't handle noisy images very well, but it is very robust to drift. And I've seen in the chat from Miles how fast you usually record for ultrasound techniques. We'll talk about that a little bit later, but typically around 150 hertz, so 150 frames per second. They can get up to about 210 to 220 frames per second if you're really sacrificing image quality. But I think that 150 frames per second is sort of a good trade-off between image quality and frame rate. And frame rate's really important for this fascicle tracking. So we'll get into now the first tracking software, which fuses optical flow and line detection methods. So it sort of gives you the best of both worlds in that it's relatively noise and drift free. And I found that this particular software tends to work really well for relatively dynamic movement, where there's a lot of movement happening in your image and thus a higher possibility of drift accumulating. I don't find that it works as well for sort of slower, less dynamic movements. We'll talk about a separate tracking software for that, for those types of movements in a minute. Again, hopefully you've had a chance to download the files that I put on the Google Drive. Sorry, the ultrasound data or ultrasound data files are in particular really large. That's just the way those ultrasound videos go, unfortunately. And the tracking will take a few minutes, so I'll get the tracking software up and running, and I'll continue on the presentation while that first file is being processed in the software. And I can take some questions while that's all underway as well. I'm just going to switch over to my desktop at the moment. I'll just send a request to be able to do that. And also, one thing, like ideally we'll get through today without MATLAB throwing any errors at anyone. I've tried to make sure that all of the functions and dependencies for these software are all there on the Google Drive. I know it's all going to work on my end, but if for some reason you do get an error, it's absolutely fine. Just let me know what the error is and I'll upload the dependency that you're missing after this workshop. So I'm just going to stop my share on this and screen share MATLAB over here. Again, if you can't see this, I'm hoping everyone can sort of see my MATLAB screen now. But the first software that we're going to be using is called UltraTimTrack. Now, firstly, I'm just going to make sure that all of my files, all my folders, my dependencies are on my path. So right click and add those to your path. Then you should be able to go into UltraTimTrack and then load in ultratimtrack.m. You're going to press run on the UltraTimTrack code. Set this up to the side here. Sorry, I'm just going to make sure I'm sharing my screen so you can see everything. There we go. And this is what the TimTrack GUI will look like. What you're going to do straight away is go to File, Open Video File, and then navigate your way into back into sort of this main folder setup that has the ultrasound data folder from the Google Drive. You'll click into ultrasound data and load in the level walking.mat file. and that should load up onto your screen. So in this case, what we're going to be, and again, let me know if any errors pop up for you. And again, at the end of this, we'll make sure that everything's uploaded for you to use this properly. So to start with in this software, what we want to do is position these sort of, I guess, detection windows, we'll call them, over the deep and the superficial aponeurosis. So the green window is going to be scaled to encompass your deep aponeurosis. So that's going to be this sort of, I hope you can see my cursor here. It's sort of this white aponeurosis down the bottom of the lateral gastrocnemius muscle. So we're going to make sure that that's positioned over it entirely. So the whole field of view encompasses that. And then same sort of idea for this blue field of view, but over the superficial aponeurosis. So that'll be this top white line here. Now there's a whole bunch of settings over on the side here, and I recommend you just keep everything as is to begin with. The main thing that you'll potentially want to play around with is this parameter here. What this does is it's going to weight more towards the ultra tim track side of things. So this sort of combination of line detection and optical flow, and lower values, on the other hand, are going to weight more towards just purely optical flow. So if we're going purely optical flow, remember that's going to be relatively sensitive to drift. If we're going more towards the ultra tim track, there won't be as much drift, but because we're weighting a little bit more on those line detection methods, potentially, there might be a little bit more noise. It might not be able to handle noise in your image quite as well. So we kind of want some sort of intermediate between the two. I'll talk about that a little bit more after we've processed the data. I'm going to click on parallel processing here. So for those of you who use sort of more powerful computers with more cores, this allows you to sort of have more workers working on this data processing simultaneously, and sort of speeds up the whole process. On just a standard work laptop, you might have 4 to 8 cores sort of thing. Whereas on, your more complex computers, you might have more like 10 or more cores. And I find that on the more powerful laptops, on the more powerful computers, this really does speed up this whole process quite dramatically. On just a standard work computer, it's going to take about, for a 10-second video, maybe something like 5 minutes to process one ultrasound video, whereas on a more powerful computer, it might take only a minute or 2 minutes. Then what I'm going to press is this detect fascicle option. And then you should get this fascicle pop up on your screen. And you can sort of confirm that it looks like these are following these sort of lines of connective tissue, being your fascicles, and looks like it sort of lines up with your deep and superficial aponeurosis. And then once we're happy with that, we press process all. This will probably take me back to this screen, telling me down the bottom here that it's starting a parallel pull. Again, just distributing different parts of this processing to different workers to work on simultaneously to speed up the process. While this is going on in the background, I'm going to just stop share on that, and we can get back into that once this is run through. But again, it started now. It should take a few minutes to get through, but I'll stop share on that, and then we can come back over here and get back into the presentation. Bear with me a second. It's trying to be in presenter mode. Okay. Does anyone have any questions to this point? Did that work for everyone okay that gave it a go? Or is it working?
Mine's working. It's not
Awesome.
finished yet.
Perfect. Stoked. That's great. Um, and does anyone have any questions to this point before I sort of go further into this? Okay. So, again, when we sort of typically think about an ultrasound probe, we typically think of it, let me get my pointer up, uh, in these sort of form factors here on the right. And that's great, again, if we want to do sort of freehand medical ultrasound imaging. But you can imagine that it'd be impossible to hold one of these probes on somebody's against somebody's skin in a specific spot while the patient is walking, running, skipping, jumping. And that's ultimately what we want to be able to do with these probes, right? Measuring fascicle length changes during these dynamic movements. Instead, we use this sort of flatter form factor um, on the left, which actually allows us to strap the probe to the patient. Um, and these flat probes were actually originally designed for veterinary purposes, but now are sort of fairly extensively used in the musculoskeletal biomechanics space. So here on the left, we have one of these probes over my lateral gastrocnemius and soleus. And you can sort of see this nice image here. I'm just going to go through some dorsiflexions and plantarflexions, and you can see those fascicles changing in length quite nicely in that image. And we also have the same thing over my vastus lateralis. And again, similar sort of thing, really good sort of fascicle length or really nice connective tissue in there. You can see it from origin all the way to insertion, changing in length with knee extensions and flexions. And if I just sort of go back, and you'll be able to see that what I like to do as well is have this sort of block of foam sitting next to the ultrasound probe within the strapping that's roughly the same dimensions as the probe. I find that this setup with sort of the extra surface area that this creates in the strapping helps with locking the probe into position and stopping it from changing its orientation. So again, can show you those videos to give you a bit of an idea of what we're looking for from an ultrasound image. Really clear connective tissue, and you can nicely see it changing length during those movements. This might be how your overall setup and device integration looks like. You've got some main computer connected to an analog box and motion capture system. We might have um, uh, some software on the main computer that allows us to send signals out of the analog box with a splitter at this junction. We can send signals um, to the motion capture system and to the ultrasound module, reaching those systems at the same time, so that they can be triggered to start and stop at the same time, which is going to be important, right, in terms of making sure that our ultrasound and our motion capture data is perfectly synced up. We know this is what happens. This is what happens to it. This is what is happening to our joint torques, our joint moments, and at this exact time, this is what's happening to our ultrasound. or fascicle length changes. The ultrasound data will be collected on its own ultrasound laptop. And we also have a signal coming out of the ultrasound module back to the analog box connected to the main computer, just verifying when frames of ultrasound data are being collected as one, a bit of a sanity check, or also just to help realign the data down the line if anything happens to go wrong with the sync for whatever reason. And just a note, if you're working with Echo Wave software, which is sort of the main software that we tend to use, there's this ArtUs sync software that you'll need to have enabled in order for the ultrasound system to be engaged correctly to register those syncing signals to start and stop capture. This is obviously in place of just manually pressing spacebar on the ultrasound laptop and starting and stopping the capture yourself. But we can go back now to, I'll just stop sharing here, and we can go back to that fascicle tracking that we were just doing before. Hannah asked, portable/wireless ultrasound probes is accurate and reliable compared to ultrasound probes with cables. I haven't played around with wireless sort of ultrasound probes in the past, so I'm not exactly sure the answer to that question. But I do notice I've done a little bit of uh, like sort of ultrasound imaging primarily for like physiology research, again, sort of looking at cardiovascular biomechanics, looking at blood flow in vasculature in the past. And I have found a very big difference between these telemed systems that we're using here compared to like a proper full-on medical ultrasound imaging setup. In that case, that is far better for scanning vasculature and making those blood flow velocity measurements. The main thing here is that you can see those connective tissues nice and cleanly, and that you've got a high enough frame rate. So again, I find that a frame rate of around 150 frames per second is excellent for fascicle tracking. I wouldn't want to go much lower than 120 or 100 hertz for these automated methods. That's when I find there tends to be a lot more noise or just inconsistencies in my fascicle length measurements from these tracking software. I'm just going to set up there again and try to share my screen. Okay, and we'll go back to those fascicle length measures. So you'll see here, this is excellent. You should be really happy if you get this sort of outcome from the ultrasound tracking. Again, you'd obviously want to verify this against data in the literature or your own sort of data from walking in the past. Again, this is from walking, so after this, you might want to sort of cut up this data and compare it to walking data in the literature. But we can also press then this play button and see how well it is tracking these fascicle length changes. It should do a really solid job. Obviously, in data processing, we'll still do a little bit of filtering of these trajectories as well to get rid of some of the noise here, but that's excellent. Another sort of sanity check as well is that optical flow is a really good method for detecting fascicle length changes. Again, it is just prone to drift, but it is sort of a good thing to compare these sort of measures that we get here, which is sort of from an intermediate tracking between optical flow and line detection. But what we can do is change this parameter in this box and make it much, much smaller towards what would be optical flow. You should see then that this tends to drift out, but it should give you an idea, at least for the first couple of fascicle or the first couple of movement cycles, whatever that movement cycle is, it should give you a good idea of what those fascicle length changes should be looking like throughout the entirety of this ultrasound video. But we can then change this back to 0.01 if we wanted to, or make it slightly lower if we wanted to favor optical flow a little bit more. Also, when you're sort of getting started up with this, it's worth pressing this SA button. What that's going to do is perform a sensitivity analysis. It's going to go through step up by increments of sort of like 1 decimal place. So it will start at a really, really low value for this parameter and then slowly work its way up towards 1 and then spit out the ultrasound, the fascicle length that is measured for each of those different parameter values. And then you can sort of figure out what works best for you and your ultrasound images with that parameter. And then if we wanted to, we could go File, Save Tracking Data As, save as a MAT file, export it, and then do our data processing on it. Have, force data from the same time, cut this up into strides of data, and look at it in that sense as well. So that's that software pretty much for now. That's all you need to know. But if there are any further questions that pop up down the line after you've played with this a bit more, you can let me know and we can talk about it. Tim Vanderzee, Dr. Tim Vanderzee, who's in this sort of IMSI network as well. He's the person who created this software, and I'm sure he'd be able to answer any questions you have as well. So we can exit out of that, and I'm going to sort of talk about the next fascicle length measure.
Can
Yeah,
I
Monica?
ask a question while you're switching?
Yeah.
Have you compared manual tracking to this auto tracking for the same videos to see how they compare?
I haven't personally, but when I've spoken to Tim about this particular software, it was a really extensive process that he went through involving
Mm-hmm.
manual tracking, I believe, at least for this next software that I'm going to show you, which is called UltraTrack, which is just optical flow. We have done those comparisons between the automated methods and the manual methods, and it's really solid. So should be confident in what the measures are giving you. So get my bearings for a second.
We have one more question in the chat as well when you have a second.
How does the software choose a fascicle? Is there variability in the length changes among fascicles? This is something that I need to look into as well myself a little bit more for this Ultra TimTrack stuff. This is a relatively new software. As far as I know, it uses those line detection methods and will take an average of what lines are detected and select that as its fascicle with those sort of deep and superficial borders created by the aponeuroses that are detected. In this next method that I'll show you, it is done manually, but or in most cases it's done manually, but using the simple muscle architecture add-on in ImageJ. I've used that previously for automatically detecting fascicles within my ultrasound image, and then I've taken the coordinates of that fascicle that's detected in image J and imported that into my ultrasound image as the fascicle. So that's like an automated way of doing it as opposed to manually doing it. So using image J in the simple muscle architecture analysis, and that was created by Neil Cronin, if you're not familiar. With this software that we're going to be using, again, this is, again, optical flow, involves a bit of drift problems, but it's insensitive to noise. And there's going to be some discrepancies between this software versus using Ultra TimTrack's optical flow. Even though they're using the exact same method, there's something about the fusion of methods used by Ultra TimTrack at the moment that limits us from going into full optical flow, or at least it being the exact same output as I get from this UltraTrack software that I'm about to show you. That's something that Tim and I are working through at the moment, so that we can just have everything in one software that can handle whatever movement you're interested in tracking. But at least for now, we can quite easily use this other software. And again, it's really good for sort of slower movements, controlled movements like those in a dynamometer, or movements like a Nordic hamstring curl, or maybe even like a sit to stand. So the video that we'll track in this software is just from sort of slow passive rotations of the ankle joint in a dynamometer. So what we'll do is go back into like our main folder set up from the Google Drive. We're going to go into UltraTrack v5.3 and select this UltraTrack v5.3 mat script. And then hopefully that loads for us. Yep. And then again, just click run, and you should have this GUI that pops up. So again, I talk about this being, a relatively drift prone method, but there are ways that we can correct for some of that drift. I'll just talk about that really briefly. So if I was to open up that video file back from that walking data that we looked at just before, so this level walking mat file, you don't have to follow along with this particular thing, but I'll show you how, I'll show you just a strategy for working around drift here. We can load in this ultrasound video file, and we can also load in a data file. So I can load in a C3D file that contains, force data or marker data. So this is from the same trial. And down the bottom here now, we can see all of these different options from my C3D file. So I might load in force data from in the Z direction. So I can then detect roughly, or know where roughly in the movement cycle I am. I can then go to a really defined point in that movement cycle. I could then manually set my fascicle, or manually choose my fascicle. I could then go to tracking, fascicle tracking, and then save that fascicle. And then in the next ultrasound video that I open up, I can go to that exact same point in the stride cycle, load in that fascicle that I've used in the previous trial, and then we're using the same fascicle for each individual ultrasound video. And that's ultimately what we want to do, right, for consistency and to avoid bias where we can. But that's really cool. And then again, like once I go through this next video, this will make a little bit more sense. But we can then, once this video has been tracked, go to these points in the stride cycle and add what are called, in this case, keyframe corrections. So if we go to the exact same point in the stride cycle or movement cycle throughout this movement video, add keyframes to each point, that's going to remove drift between those points. It essentially assumes that, okay, this is the fascicle length here, it should be the same here, 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 and then that removes drift that way. So it should be a relatively flat output of fascicle length. But getting into the actual example that I want to talk about, and this is sort of from these passive ankle rotations. So just following along with me, open video file, choose this top ROM 24 T1. That will load in this video. This is a bit of a longer video. This one's about 20 something seconds long. So or close to 30 seconds long. So this will take a little bit longer to process. And the disadvantage with this software at the moment is that it doesn't have that parallel pool software for processing. So it might take a little bit longer than Ultra Tim Track in some cases. What we're going to do is we're going to fix the region of interest. If we don't fix that region of interest, we tend to see that the region of interest that we select, again, region of interest will make more sense to you in a second, but that will sort of shift and turn with the optical flow. And sometimes that region of interest just ends up somewhere we don't want it to be. So I like to just fix this region of interest. I'm then going to click define ROI, define region of interest. And then we can go onto our ultrasound image, starting along this sort of top aponeurosis. You can start along the bottom if you want, but we're just going to create a rectangle defining the region of interest that we're sort of interested in. Go along this superficial aponeurosis, click on the corners, click down along this bottom aponeurosis, and you can click as many times as you want if you have more complex structures that you want to define as your region of interest or complex shapes. And then finish it off at the end and just double click to do that. You'll then have this sort of dotted region of interest. You can then press define fascicle, but just wait a second before you press define fascicle, or if you do, just double click in this space and you can then come back to defining fascicle in a second. But you've got this res millimeters per pixel, and this is a value that you're going to have to determine yourself with whatever ultrasound setup you're using, whatever sort of ultrasound settings you're using. This is essentially converting length in pixels to length in millimeters. So we've got millimeters per pixel, and for me and for you to enter in this case, that value is going to be 0.093. And I've outlaid the instructions for determining what that value is in the documentation on the Google Drive that I've uploaded. But make that value 0.093 and then click on define fascicle again. And then again, this involves a little bit of experience knowing where this fascicle should be originating from, where it's inserting, to know how to define this fascicle. But we do this manually in this case, or like I said, we could use IMSI and then import the coordinates from IMSI to define your fascicle for you. So I'm going to say my fascicle's originating from here, and let's just say it's finishing in this top right corner here. And then that's all you really need to do from here. Again, you can go into tracking, fascicle tracking, save that fascicle, reload in that fascicle for the next ultrasound video that you're processing. But then we can just go again, process all. This is going to then go through, process, same as the TIM track, and then we'll get an output in the same. Again, this is just passive ankle rotation, so it should be a really controlled movement. We're going about 5 degrees per second. So I think dorsiflexing, holding still, then plantar flexing, going down, holding still, and then dorsiflexing again. So you should see a really controlled pattern like that with the output from this tracking here. And again, while that's sort of taking its time, I might, well, how long has that got to go? We can wait for this actually. It shouldn't take too long. Does anyone have any questions again while we're waiting about this software? The other neat thing about this software too is that you can sort of jump forward in time to find where maybe the fascicle's at its shortest length, so that you've got that insertion and origin really clear in your image when it comes to then defining your fascicle. This is what I recommend doing, trying to make sure that the fascicle's at its shortest length when it comes to defining that. So again, you're not extrapolating, outside of this image to areas that you can't see too much when it comes to defining the fascicle. So you can skip forward in this, find where the fascicle's at its shortest, compare or find where you are in the movement cycle based on that force data down the bottom, or whatever data it is. It might be marker data. And then process from there. It's going to process forward in time, and then it'll process backwards in time as well to get any frames before that, which is a really neat feature as well. Unfortunately, I didn't have a C3D file for this particular movement, hence why I haven't shown you that, and I showed you one for walking instead. Nearly done now. So there we go. That's the outputted fascicle length trace up in the top right corner there. And you can see not much drift happening at all. Really, really nice, really nice tracking in this sort of nice, slow, controlled movement. And again, if we did have C3D file here, we'd be able to add those keyframes in different points. I recommend just doing that anyway to make sure we're accounting for any drift. Again, I can press play on this. It's going to go through frame by frame and show you the tracking as well. And if you wanted to, I think you can go file and save video as well. So you could save this video for a presentation or whatever you wanted to use it for as well. And that's essentially the gist of that software as well. If you've got any questions, let me know. It's not too much more complicated than that. I'll stop sharing over here. Do you have a way to time sync these videos with movement videos? It looks like the fascicle length is maxing out. So for Jill's question, you would want to have some sort of trigger out coming from your camera that you're using to record those movement videos from, to be able to sync these up down the line. That would be the ideal scenario. If not, you might want to have some sort of you really just want to make sure that these are starting and stopping at the same time, or that you have some sort of biomechanical data that allows you to know, okay, this is where my ultrasound data is at this time, and this is where my movement data is at this time. I haven't done this previously, so I'm not really sure the best answer to give you there, other than try to make sure you've got some sort of setup that allows you to trigger both systems at the same time, and stop at the same time. For Kisa, again, this is exactly what we would want to see. I'll go back to sharing my screen. This is exactly what we'd want to see, because again, we're going through these passive ankle rotations. So again, the movement itself is actually starting neutral, going to dorsiflexion, staying at dorsiflexion for a few seconds, and then going down into plantar flexion. So this is just representing the fact that the ankle is being held still, which it is. Yeah, it's not maxing out. Shouldn't have any problems with that. So I'll get back into the presentation. So this is probably a slide that you'll want to come back to later on. It's really just showing you the range of settings that I personally think are worth experimenting with to try to optimize your ultrasound image. The optimal settings can vary from patient to patient, from muscle to muscle, depending on maybe the patient's body composition, depending on the muscle's size or depth in the image. But the settings that are put in parentheses on this slide here, I think are good defaults to sort of start from, and will give you that sort of frame rate of 150 frames per second with these particular types of ultrasound systems. Again, one of the trade-offs with these settings is frame rate. So while it's important for the fascicle tracking to have clearly identifiable deep superficial aponeuroses and line-like structures, so your fascicles, it's just as important to have a really high frame rate with these videos as well. Again, if you have a low frame rate, the tracking is just going to perform really poorly. Typically, again, that higher frame rate is at the expense of image quality. Maximum frame rate of these systems is around 210 to 220 frames per second. But again, I think if you're aiming around 150 frames, 160 frames per second, I think that gives you a really good trade-off between image quality and frame rate. I've also put an asterisk next to the settings that I've found have a big effect on frame rate as well. Those particular settings will change the depth and width of the image, so the overall field of view of the image, as well as the number of ultrasonic beams used to scan images as well. Again, for when it comes to things like depth and width, I find that with about a 50 millimeter depth, we've got about 80% of view area, so essentially width of the image. If you're going to like a 60 millimeter depth, you're going to have to reduce that view area a little bit, let's say to 70%, because again, we've got a bigger field of view, and that's going to have a significant effect on the maximum frame rate that you can get out of the system. So these are good starting points. And there's also this setting as well, which is a little bit harder to find. It's in the options pane in the Echo Wave software that we're using. But this also, yeah, has a profound effect on frame rate. It's the sign size, which essentially changes the number of frames that can be collected if you just let the software run. So we want to make sure that we max that out to get the most out of the system. Jill's got a software. Is there a way to add a universal timestamp to the imaging from the ultrasound setup? That's a really good question. I'll have a look and get back to you. I haven't really worked with this outside of like a motion capture setup where we've got sort of sync signals being sent from one device to the other. But I can imagine maybe if you had a universal timestamp, or you had the date and time in real time from the ultrasound machine and from your video recording device, maybe you could sync things up that way. It's a good point. We should look into that and talk about that. And I guess to sort of wrap up with sort of listing some advantages and disadvantages of maybe ultrasound with, say, sonomicrometry, where we're instead sort of surgically implanting two sensors along the length of a fascicle to make fascicle length measurements. Of course, this being a technique used for animal research, not humans at the moment. But really, a lot of this is pretty intuitive, right? The main advantages of using ultrasound are that it's non-invasive. You get a bit more detail about the movement of surrounding structures, and it's highly portable. It's highly portable and easy to set up and sync with other devices. The main real drawback here is sort of the temporal resolution, so maxing out at around 200-ish frames per second. If you're really sacrificing image quality, as well as the fact that there's a reliance on computer vision, which obviously isn't without its bugs and problems as well. But again, I've sort of put together a list of procedures for processing ultrasound data using the programs that we did, that we played around with today. And of course, you can reach out to me on Slack or this email down the bottom here if you have any questions as well. And again, feel free to sign in if you haven't already and give feedback on all the workshops to this point. Yeah, if anyone has any more questions, but that's about it from me.
That was really useful. Thank you.
Thanks. Cool. I'm glad. And yeah, it is just one of those things. If you've got access to an ultrasound machine, play around with it, get hands on, because a lot of what I talked today, it's great to be able to just say that on a presentation, but it's another thing to actually see it for yourself and play around with these different things.
All right. Does anybody have any more questions before we wrap up for today?
Luke, I have a question, and it's more of like maybe a theoretical question, but I would say, what do you think are the limitations for using ultrasound to really study dynamic movement? So as opposed to, I mean, our is kind of about like how we investigate, dynamic movement versus more static and quasi-static type movements. And so what do you think are like the strengths and weaknesses of this approach in particular for dynamic movement?
Yeah, I think the main limitation is the frame rate. With a lot of the devices that we're using, obviously we can get those up to sort of 2000 hertz, and we like to have them up with a really high frame rate. But for this, we are really limited to maybe 150 hertz if you want a good trade-off there. But I think, just based on my experience, and we're doing some perturbed movement stuff at the moment where we really want to hone in on sort of that preflex phase of muscle. And I think it's going to be fine even for that sort of stuff as well, given the ultrasound tracking algorithms that we've currently got. I think if you asked me a few years ago what the biggest limitation would be, it would be that we're using optical flow and that it's prone to a lot of drift. But now I think that issue has been taken care of. So I think it really, the main issue is the frame rate and just expertise, getting hands on using it. Yeah, I think that's it. And the integration with motion capture systems initially is a little bit to get your head around, but it's really not too bad either. So yeah, I think it's overall pretty good for what we would want to use it for, at least.
Thanks.
Is this something we can try in a pop-up arena? With video stitching at even 120 frames per second?
Yeah, I'm still not really familiar with so pop-up arena just being like a pop-up just setup, just
Yeah.
capturing.
So we're exploring ways of integrating information. That's why I was asking all the time sync questions, right?
Yeah.
So yeah, because it gives you context, right, of what's happening, the individual muscle, what its role might be in the movement, and it may help bring more people understanding where we are in the context of what's happening
Yeah.
at the muscle level, the context of the bigger task. And so we're looking at ways of streamlining that piece of it so the understanding can come about. So that'd be really awesome to try some of those things and experiment. We're not too far away from each other. Maybe we can arrange for something like that.
Yeah, that'd be awesome. And sort of it's really nice in that it is a relatively portable setup. The only problem potentially is that, it needs a power source. So you would obviously need to, like, if you were outside of like a treadmill setup and you had like a runway or something like that, you would need the module strapped onto the participant's back in some way and long enough power cords or some, portable charging system as well to have going with it as well as having, obviously a long enough cord that or USB cord that's going from the device into the laptop that you're recording things from as well. So there's a few challenges there with portability that we'd have to work through, but that comment about universal timestamp has got me thinking as well. So yeah, we should chat more about potentially using it.
Yeah, so with the evolution of telemetered EMG and these kind of things, we've gone from cords to telemetered and those kind of things. I just don't know where ultrasound is in that space. Some of that technology exists, but probably in other domains. So, but we can chat further about kind of what we might be able to put together and integrate. So thank you. This is really helpful.
Yeah, that'd be cool.
I think ultrasound is pretty data intensive, so you might face some bandwidth limitations with telemetered data where you have to make even more pronounced trade-offs between like the resolution and frame rate than you would with the wired version of the system, right?
Yeah, I keep thinking about our instrumented cross-country skiing in the snow with little data processors and butt packs and things like that, where it might be saved locally and then transmitted. So it's not real time, but it would be a movement would be authentic, but the data could be, if time stamped, could be integrated at a later date. Yeah.
Yeah, and this is sort of the module and sort of system that I've shown you today is just one system, but it tends to be the one that's used across all of our sort of labs. I'm not sure. I haven't looked too much into, like, there was a comment there about wireless ultrasound systems. Again, I suspect Monica's comment would be important for that. But could be cool to look into.
Yeah, especially as we get into like the risk reward and, challenges and choice and these kind of things. It's nice to see where we are and then what might be feasible in that space.
Mhm.
And it's clearly relevant to the theme of IMSI of trying to
Yes.
integrate across scales.
Absolutely.
So, yeah. Any other points for discussion, questions? Luke, what's the typical size of the field of view that you're getting?
I measured this the other day. How do I not remember this? So 50 millimeter depth by probably like 40 millimeters width.
Mm-hmm.
I think that's about what it is. But again, you can go deeper than that, but you would sacrifice the width of your image a little bit as well.
Mm-hmm. It's too bad that it's probably the probes are a little too heavy for a guinea fowl to be carrying around, because you could image most of the entire muscle plus the muscle tendon junction with
Yeah.
that field of view in a guinea fowl, but it would be a bit much for it to strap on its leg.
I think so. Yeah,
Yeah.
yeah, on its leg especially. It's not just like
Yeah.
the weight of it, but it's just a bulky in that
Yeah,
like in that
bulky.
size, that scale of things. Yeah.
The cable's bulky, so it would restrict movement as well.
Hmm.
How do you manage, is cable management a problem for these studies? How do you deal with that?
It can be a little bit of a problem with making sure that the cord going out to the ultrasound probe isn't hitting on the treadmill belts when we're doing treadmill studies. So we typically have to like tape down the cord in some way that restricts it from doing that. But otherwise, no, the cable management isn't too bad. You just got a long cable coming out of your analog box, whatever that is, going into your ultrasound system. Sometimes that can get a little in the way, but I haven't had any problems in here, at least in our lab. Haven't had any problems. Not in my lab at UQ either. So
Similar
Right.
question about setup. Do you ever have issues with like slippage during your tests and things? 'Cause it looks like you were just kind of strapping it in with a band.
yeah, that's a good question. And again, I think in the past we might have had some issues with that when I didn't have that piece of foam has made a big difference. Just sitting that next to the ultrasound probe, I know that sounds like a pretty crude way of doing things, but um, having that sitting next to it really helps make sure of that. Um, but I haven't had any issues with slippage or anything. You've just got to make sure that it's strapped down as tight as it can within the participant's comfort level, and also making sure, obviously, that you're not deforming the muscle too much. Having that probe over the top of it and strapping it down too much too. So it's a bit of a balance, but really with enough of that co-band, co-band is my life. I love co-band. Um, enough of that really does the job. So
We
yeah,
definitely buy that stuff in bulk in the lab.
yeah, yeah. Usually, yeah, 3 rolls a testing session will go through of co-band.
All right. Well, unless there's any other questions, maybe we're ready. Do we need to do the sign-in thing again in case anybody joined late? Or
Um, yeah, I can also put that into the Slack. Here, let me just copy this link now while I'm working. I did also want to remind you all we have the workshop next week, going back to our normal Thursday schedule, and that will be an introduction to mechanics of the musculoskeletal system. So be sure to join that. And then also I sent out the entry survey earlier this week. So if you didn't receive a link, this would be to trainees and mentors. If you didn't receive a link, let me know. And if you've already started your project, please be sure to fill that out as soon as you can. And then just as a reminder, as well as you kind of go through your projects, remember to take a look at the mentorship curriculum this summer. It's kind of a little bit asynchronous for now, but I will send out more reminders as the live sessions come up. I think that's all
Great.
I have. So thank you all.
Well, thanks, Victoria, and also thanks, Luke. That was really useful, and
thanks,
thanks for
Luke.
sharing the data and the software to play around with. It'll be cool.
It's okay. Cool. Yeah, let me know if you want more data to play around with.
Yeah.
Cool.
Thanks.
Thank you.
Bye. Bye, everyone.
Bye, everyone.